This presentation will explore the Radiology 2.0 One Night in the ED application, available for iPhone and Android devices, presented by Matthew Goldberg. This application is designed to aid providers in reading and understanding computerized tomography, or CT, imaging, and its use in diagnosing patients that present to the emergency department, or ED. It provides almost 70 cases of actual patients and their complaints, as well as the imaging studies conducted during their visit. It provides the findings and diagnoses for each case and provides further information and education about each of these findings. This application is mainly geared towards ED physicians and residents, as well as radiology students or residents learning to read CT images and diagnose them with them. It can, however, be very useful to nurses, mainly in acute settings, in understanding the pathology and anatomy associated with abdominal and thoracic cavity patient complaints. When they present to the ED, nurses can utilize this application to conduct further personal research in order to better understand warning signs of conditions and be better prepared through this to treat their patients most effectively. This is a very simple to use application. It opens to its homepage, which has only a few buttons to use. One leads to the help page and application information. Another turns on and off answers, and the final one takes you to the list of cases to practice with. Each case opens to a CT that the user can scroll through by clicking and dragging, as well as the patient's initial complaint. There is a button to enter the discussion page, which then provides easy-to-read text information on the case and findings from the images. When the user is done reading, they can click Case Closed, which returns them to the list of cases. The application gets no more complicated than that, and is thus very accessible to any demographic using it. There are really no legal or ethical implications surrounding this application or the use of it. The cases it utilizes to teach users contain no personal patient or identifying information that could in any way violate privacy rules. And the application itself contains no way to enter or save any information regarding patients within it. It is therefore very safe to use in a clinical setting or outside. Overall, this application is most beneficial for those with some background knowledge and understanding of CT imaging studies who would like to become better at reading them and understanding acute abdominal and thoracic conditions. The application is simple to use and therefore is limited in that it does not teach users how to read a CT scan from the beginning, but instead assumes the user has some knowledge in the area already. Any provider looking to gain a better understanding in acute care areas of these conditions can benefit from this application. To conclude, this application provides a self-guided education through the use of actual cases that presented to an ED with complaints of abdominal and thoracic issues. The application is relatively simple and easy to use and should not take most users long to adapt to and understand it so they can utilize it to its fullest capabilities. It is best suited for those with some knowledge of CT imaging studies. However, any provider with an interest in the subject matter can still gain from using this application.